So in this particular study, we chose obese children and adolescents who had low vitamin D levels to begin with. We gave these children vitamin D for 3 months and performed the study of the brachial artery, the artery in the arm, at baseline at the end of the 3-month period. We also checked blood sugar and cholesterol levels to see what vitamin D administration can do to these levels. To our surprise, we did not find any beneficial impact of vitamin D on the dilatation of the brachial artery in these overweight children who had low vitamin D levels to start with. Overweight children are at risk for developing diabetes and metabolic syndrome, and many have evidence for abnormality in their arterial function, or we call endothelial dysfunction. Many have endothelial dysfunction, which is a marker of cardiovascular disease later in life. So because we really don't know what the implications of low vitamin D levels in obese children are, I began studying this about 8 years ago. Vitamin D is being used over the counter by children and adults at doses sometimes that are not safe. For instance, I certainly see in my clinic patients that are on vitamin D doses that are sometimes 5 to 6 or even 10 times the recommended dietary allowance. So I think we need to better understand if giving vitamin D in obese children has any beneficial effect at all on their metabolic health by doing this longer-term, larger studies. So I think it was important because we were targeting obese adolescents that are at high risk for diabetes and cardiovascular disease, and these are adolescents that had low vitamin D levels to start with. So I think this study was important in that way. Having said that, the duration was only 3 months, and it remains to be answered if longer duration of administration of vitamin D may have helped more.